urology. Urology is a surgical subspecialty that focuses on diseases of the urinary tract, okay, both men and women. So kidney, bladder, prostate, and the genitourinary organs in both men and women. So we treat people, essentially of all ages, men and women, benign conditions and also cancer. So some of the cancer conditions we treat are kidney cancer and bladder cancer and prostate cancer. And I want to feature, one of the treatments we have on bladder cancer. And then some of the benign conditions we treat are voiding problems in men, so otherwise known as BPH, kidney stones. And the reason I kind of bring it up, kind of what the overview of what we treat is that of really the three most common conditions that we treat are kidney stones, voiding problems in men, and bladder cancer. And the hospital has really invested quite a bit of money into bringing the equipment necessary for us to have a center of excellence in those areas. And let me talk about it in a little bit more detail. Stone disease, the most common way we treat kidney stones and stones in the urinary tract is through a procedure called a ureteroscopy, where we take a lighted instrument and it goes through the urethra, into the bladder, up the ureter tube, and we're able to identify the stone and then use a laser to break up the stone. Traditional lasers are about 20 watts. They bought a 120 watt laser, and what's the downside of it is that we can do the same case in about 40% less time. So it will reduce the amount of time that you have if you have a stone under anesthesia. I've had a stone and I've had to have surgery to treat that. So, and that's really one of the most common conditions we treat. The other thing that this laser does is that I'm a center of excellence for BPH, meaning that voiding dysfunction in men. And one of the procedures I do requires the use of that laser. It's called the holmium laser enucleation of the prostate. And we didn't want to lose for lack of promotional materials, so I brought these brochures that this one talks about the HoLEP, okay, what the HoLEP is that people have heard of a TURP. Well, a TURP is pretty much what your grandfather had. It's a procedure where we take a lighted instrument to go through the urethra into the bladder, and then use a special loop or instrument, or more recently, you've heard of a green light laser or something to vaporize the prostate. The HoLEP is, at least in the UK and Japan, the first go-to treatment option, and the reason that is that it's really the best option worldwide. It's the most effective, least amount of blood loss, quicker return to function, lowest complication rate of any other procedure for the treatment of BPH. The reason it hadn't really taken off in the US is that there's so few training centers. So I train in Cambridge, England with the head guy in the world, and we have a collaboration, and I've treated over 300 or 400 patients with the HoLEP procedure. And then the other procedure we do, we're a center of excellence, is called the UroLift procedure. This is an office-based procedure for BPH, okay? This one, I've treated 600 patients and actually wrote the article on how to do the procedure in the office. And so we're able to provide, men of East Texas with really the state-of-the-art treatment for BPH with the UroLift and the HoLEP. And then the third thing I wanted to kind of highlight is the bladder cancer. And if everybody can take a look at this packet, bladder cancer is a very common cancer, especially present in older men and women. The top sign of bladder cancer is blood in the urine. So if you have blood in the urine, it's important to get it checked. But I want you to focus on this. This is the page right here where it has 2 rows of circles, okay? Traditional ways that we identify bladder cancer is we use a lighted instrument, a scope in the office to go through the urethra into the bladder, and we look at it under a white light. We're able to detect bladder cancer in that fashion. The problem is that there are certain aggressive types of bladder cancer that you can't identify under traditional white light. And that's a problem because you can, even if you're doing surveillance and evaluating for cancer and removing removing what you see, you don't know what you can't see, and unfortunately, people go on to progress and ultimately need to have their bladder removed, okay? What blue light is a special procedure where we place a catheter in through the urethra, we put medicine into the bladder, and then use special equipment to shine blue light on the bladder, and if there's any bladder cancer, then it will fluoresce under blue light. And the studies show that, essentially you have a 30% higher detection of the higher risk cancer. And what does that mean to you? Well, if you have bladder cancer, it means that when we do this, you're not going to miss it. We're not going to miss the opportunity to treat it. And of the centers that have blue light, Titus, is in the same company with UT Southwestern in Indiana, being the only facility to offer it, where we have blue light cystoscopy in the office as well as in the OR. So, I think it's really important to get the word out that we're doing state-of-the-art procedures and treatment at Titus Regional Medical Center. So we have some business cards here and promotional materials and so forth. And I also want to just take the opportunity that if your business has an insurance plan and we're not on it, please let us know, because we need to get on it so we can take care of you and your employees.